Okay, so this is going to be a very quick summary of the upper and lower custom trays and how they relate in the clinic and the reasons why we made them a certain way. So if you recall, the maxillary custom tray is finished to the line that we scribed on the cast, and that's just the line where we think the final prosthesis is going to finish. And according to our model analysis, this custom tray is fabricated right to the line. And if you recall from the video, or if you're planning on watching the video on border molding, by the time we incorporate tissue stops, this custom tray should elevate slightly off the tissue, and it provides just enough relief from the vestibule to allow border molding compound and impression material to fill in that space. Okay? The handle is pretty much straight up and down off the crest of the ridge. It's centered to the midline. It's rounded, so nothing is sharp. The edges of the tray are rounded. They're smooth to the touch. Relief of the buccal and lingual frenums. And everything should fit onto the cast without any wedging effect. Therefore, you're not engaging the undercuts. And it's relatively right to the line, if not right on it. Okay? If this had a wax spacer incorporated in the fabrication, we would leave this tray slightly short of the line, because the wax spacer, of course, we incorporate the tissue stops, and therefore this allows room for the border molding compound and impression material already. But since we didn't do tissue stops, we're going to take it to the line. The lower, we have 3 different variations. The first one is just a simple handle. This could work, but I think you're going to find yourselves doing a little bit more work when you're inserting this in the patient's mouth and having to put your fingers to hold it down during border molding and final impression. You're that much deeper in the patient's mouth, and I think it's going to make it a little more uncomfortable. This particular one has the tissue stops already incorporated. Therefore, this was fabricated because we used a wax spacer. So when we do that, the tray is finished short of the extension, about 2 to 3 millimeters short all the way around. And of course, we have that relief on the inside to allow room for impression material. So that would be one variation, just with a simple handle. This could work, but I think when we step up to the handle as well as the finger rests, I think this is a much improvement here, because this allows me to put my index fingers or third fingers over the finger rest, further stabilizing the custom tray, and I think it provides a better final impression. This particular tray, unlike the one you saw with just a handle, does not have tissue stops. So therefore, when this tray was fabricated, only the visible undercuts were relieved. So therefore, for this custom tray, tissue stops need to be incorporated intraorally utilizing the border molding compound. So therefore, this tray should, again, be lifted off the tissue by the time we incorporate our tissue stops. Okay? So no wax relief. Once again, the tray is finished right to the line. Unlike the last one, which this one here joins the handle and the 2 finger rests on either side to the height of the occlusal plane, or where we anticipate the teeth, the height of the teeth. So this one joins everything together. It's centered over the crest of the ridge, very similar to having them separated. These are still over the center of the crest of the ridge. The only difference is we're joining them together. And really, I think this is even better yet, because I can rest my fingers while this is sitting in the patient's mouth wherever I want. I can hold it from wherever I want while I'm working with a tray intraorally or extraorally, inside the patient's mouth or outside the patient's mouth. And lastly, in this particular example, we had a wax spacer. Therefore, we incorporated tissue stops. Therefore, the edge of the tray is slightly short where we anticipate the limits of the denture. On the labial and buccal side, and the lingual as well. And once again, there is relief of all the undercuts, regardless which method you use. So once again, we're centered. The thickness of this continuous rest / handle is about 4 to 5 millimeters in width. No different than here. There's still 4 or 5 millimeters in width. Even if you're using a simple handle, it's still 4 or 5 millimeters in width, just like it was on the upper. So you have to maintain a certain consistency in your work. Make sure that everything that you do has a nice smooth feel to it. Remember, this is something that's going to be inserted intraorally, so you can't have any sharp finishes to it, because you can end up hurting the patient. So once again, before you take any of these to the clinic to see your clients, they must be disinfected, rinsed off, and preferably put in a Ziploc bag before you take them to the clinic. And for good measure, once you get to the clinic, I would disinfect them one more time, just to be on the safe side.